Now let's get to the part that I hate. And so tell me about the part that I should say that this morning at ridiculously early hours in the morning we were disagreeing over Twitter and on the Incidental Economist. So let's talk about that.
Well, we can agree on what we differ on, but we both characterize it the same, which is that they have a really radical component, and it is radical, and that is to move from the ambition of community rating, although community rating in a pure form doesn't even exist in the ACA, but to move from that toward a full or a fuller experience rating or risk rating basis, which means each person who approaches a health insurer would be assessed based on their health history and charged a premium that was commensurate with that, as opposed to, say, lumping them in, whether it's age banded or somehow, but lumping them into a relatively large population, whereby the risk and the cost of health insurance would be spread over that pool. To take an extreme example, Medicare for all or the Medicare program in general pools people. Everybody in it is in one risk pool, so they have one premium, although there's some income adjustment on that. And pure experience or risk rating, in principle, each individual could have their own unique premium, and it's a totally different thing. And why don't I let you explain why some of the issues around that?
See, I think that is such a gigantic step backwards, and it's not exactly clear what one is accomplishing. I mean, in a sense, what they're worried about is that without community rating, that young and healthy people would not sign up for health insurance, and we would see sort of high premiums and things would unravel. And they have a sort of preemptive surrender strategy to deal with that, which is really to move towards these individualized premiums. And now I think they make a good point that it may be that we have to allow young people to get greater subsidies and sort of reduce the amount that young people subsidize old people within the health insurance exchanges to make things work. And I think they make a valid point that we have to be empirical about that and sort of see how it goes, be pragmatic. But the part that I hate in what they suggest is that it would perpetuate the entire enterprise of medical underwriting, and where you have to fill out a form where you have to be thinking about the fact, oh yeah, when I broke up with my girlfriend in college, I went and sought help from a mental health professional, or I had this medical problem. And the great thing about ACA is that it really sends a very clear signal to insurers, to state regulators, to consumers that the business model of trying to cherry pick healthy consumers is no longer acceptable. And it seems to me that you'd have to really give me a good argument to explain why I'd want to step back from that.
Yeah, so I'd be remiss in not pointing out that in addition to fully risk rating, they do propose income-based and health-based subsidies. So there's a little bit of funny thing going on here. I mean, the income-based subsidies is sort of familiar. I mean, that's kind of in the ACA, but the health-based subsidies, you think, well, on the one hand, you've got the insurers that are charging a premium based on your health. On the other hand, you're going to undo at least some of that with a risk adjustment system. It seems kind of strange, but I think that the idea could be, I'm not sure they articulate it this way, but the idea could be that there's some aspects of health that are really random. Whether you contract most kinds of cancer, say, and maybe those you shouldn't be kind of in a sense responsible for in a premium. And then there's other ones that probably you are based more on behavioral, such as smoking and lung cancer, and possibly obesity and diabetes. But we can argue about this specifics. But there may be some where risk rating based on those makes some kind of sense and would be acceptable. And actually, the ACA does have risk rating based on smoking status, so there is precedent for that. But I think you're right to do this in a sort of a complete way is kind of it's just too radical. It'll never happen, and I could be convinced that it should never happen. But I think the value of what they propose is it challenges us to think a little bit more outside the box or creatively about the problem that we very well may face, which is, as you said, that not enough young people are willing to enroll, and that is a problem that may be in search of a solution. What they propose may be quite overkill, but taking some steps in that direction to address that problem may be reasonable to consider, although there are other approaches like strengthening the mandate and others.
Yeah, I should have said, by the way, I should have mentioned that they do suggest that premiums would be adjusted by people's prior health status. So if you had, diabetes or schizophrenia or some ailment like that, there would be your premium would be subsidized by a technology that actually doesn't really. We don't know actually how ready for prime time those technologies would be, but there would be an effort to risk rate people's premiums in a way that would try to protect people with pre-existing conditions. There are other aspects of their plan that are many aspects of their plan that one could disagree with. One of the striking things about their plan, which I think is actually a contribution, is when they show you what an income-based, basically catastrophic health plan would look like.
One possibility, yes.
I'm sorry?
It's one possibility. I think they said when they presented it that we could decide to change the structure, the exact level of those subsidies.
But it's sort of amazing when you actually see the details. I think that many of us think the idea of catastrophic health insurance is actually pretty appealing. But then when you sort of imagine, okay, Austin Frakt has a health insurance policy with like a $50,000 deductible. That's an interest that concentrates the mind. And my wife, when she had a unexpected heart problem, we had a bill for about $60,000, and it is sort of interesting to think, how would we live our lives if we really had insurance like that? In some ways, I'm sure we'd be more creative, if we had a knee problem or whatever. But wow, we would have to. You really would have to do a kind of precautionary savings that most of us probably don't do.
Oh, sure. It's not something you could slam into overnight. You'd have to prepare for that. And you'd want to look into supplemental policies. I think it's worth saying that a key reason or key motivation for their proposal is that they're pretty concerned with the idea that health insurers will try to cherry pick or do currently cherry pick. Under community rating, there's a big incentive to try to get healthier people to enroll and unhealthy people to disenroll, and we see this in Medicare Advantage, for example, and that is an issue that they're trying to get away from. And there are other approaches, better risk adjustment, whether before or after the actual experience of the year, but they're not always adequate. So, I think it's important to point out that yes, it's a very radical plan, but I don't think it wasn't just plucked out of thin air. They were actually trying to address actual problems, and they're doing it in good faith. And I think they deserve some credit for that.
Yeah, I think that's right. And one of the interesting disagreements among many people, because these are 8 good people, they're sort of tend to be more to the right than I am, but that basically describes most people in the United States. There's an interesting question. We're right in the middle of this huge knife fight over the implementation of ACA, and that just, first of all, it poisons everything politically, and it puts us all in this battle mode. But it also raises a question: what's the kind of work that we could be doing that's helpful to help people think about short-term and long-term problems? So one extreme camp says if you're basically not researching how to implement ACA, then it's kind of irrelevant. Clearly this plan that they proposed, there's just many features of it make it politically a non-starter in terms of, it's just not going to be put through. So the question is it a useful thought experiment that gets us thinking about useful things? Or is it something that just pushes us, it distracts us from the real challenges that we have, even if we're not sort of completely locked, in the boiler room of ACA? And I think you tend to think, if I characterize you correctly, that this is valuable because it does get us to take a more outside-the-box view that's a little bit less framed by the contemporary political debate.
Well, no, I actually didn't quite articulate this. I think it's valuable to have people thinking about this. I think the timing and the nature of the unveiling of it was not good. I think implementation of ACA is paramount, and I think that in general that should be our emphasis, left, right, and center. And therefore, this proposal would have been of great value, say, 3-4 years ago, perhaps, or maybe a year or two from now, if the problems really exist. Now, I don't begrudge the scholars for thinking it through and even coming up with a report, but to release it in the Beltway right now. At AEI, which is,
I should say it's a conservative think tank.
Yeah, I'm not sure that was the best way to get the best reception for it, and and so I would say that if I were managing how to publicize this, I would have done it differently. And I don't think this is necessarily the best timing, and I don't think all of us need to be thinking about this problem in this way right now. I mean, there's so many other problems, and problems not just with ACA implementation, but problems with the reception of the Affordable Care Act. I mean, it's really crucial that the degree to which it's supported and the way it's discussed in different states by different stakeholders is so crucial. And it's going to really matter for people's response and how successful it is.
We'll make one final point, because I think we want to be a little briefer than I sometimes am in these curbside consults, which is if in fact ACA really starts to unravel and community rating proves very difficult to sustain in a market system, it really calls to mind for me another outside the box idea, which is really whether something that looks more like a single payer model is actually more realistic, because none of the social democracies in Europe, none of the other wealthy democracies that have market systems are doing any kind of individualized premium, and in fact they all find ways to prevent adverse selection by some sort of gigantic risk pool mechanism. And if our market system can't make that work, then I think that's telling us that there's some fundamental problem in the way that we are expecting private insurers to assume a responsibility that they're really not capable of doing. And so it's that you could imagine the AEI response to some of ACA's implementation problems. You can imagine people on the left who are just as rigorous in their thinking, saying, you know what, the idea of a private market-based model is not working, and so there'll be I think people who favor a private insurance model should hope that ACA is implemented effectively, because that creates the space to be innovative with it. And if it fails, I think that ultimately that really increases the probability that we'll end up with a Medicare for all type system in one way or another. Maybe, I don't know if it would be quite a Medicare for all, but something that would look more like a single payer than what ACA is.
Yeah, I think you're right, and I think despite the fact that the ACA was passed by Democrats, it really is a conservative or at least right of center structure, and I think you're absolutely right. I think conservatives who are attacking it do so at some risk, because it's not clear at all to me which way we would go if it does start to fail, and I don't think it's necessarily probable that we'd go the direction that this proposal is putting out there. I think the direction you specify is as likely, if not more likely. I mean, I personally don't know. I wouldn't put probabilities on it, but I'm not at all optimistic that the authors of this report have predicted correctly how things will evolve.
Well, I think we should probably stop here. I would say we do like the authors of this report, even though we don't necessarily like all the elements of the report, and it is a valuable thing to get us thinking. So, Austin, it's been great talking to you, and I'm going to hit stop on the record.